Hey YouTube, it's your boy Kenrick here again, aka the Optometry Prodigy. And guys, this week we are continuing with our eye muscles. Last week we looked at the origins and the insertions of these muscles. So this week we're going to have a look now at the muscle movements, the movements that these muscles are able to carry out. We call them the primary, secondary, and the tertiary. So guys, let's jump right into it. Okay guys, so before we go into the muscle movements, let's have a look right now at the stuff we looked at last week, just the muscles themselves. So we have the medial rectus, lateral rectus, superior rectus, and that's the superior oblique there, superior posterior temporal quadrant up there. We have the inferior rectus, and then below there as well the inferior oblique, that is in the lower temporal quadrant. It inserts laterally, so upon the side here. That's the inferior oblique muscle. And of course our side shut here, this is the lateral rectus, superior oblique coming there, inferior oblique, inferior rectus, superior rectus. Remember our pulley system, which is the trochlear. So these are a few words that we need to look at as we are going to talk about the eye movements. Adduction. Adduction simply means the eyes moving towards the nose or towards the midline of the body. Then we have abduction, moving away from the nose or away from the midline of the body. We have elevation, looking up. Depression, looking down. Intorsion, which is a torsional movement or rotating inwardly towards the midline. Or extorsion, a torsional movement moving outwards away from the nose, away from the midline, or simply rotating outwards. And these are the things we are going to look at here. So we're going to look at the muscles, the primary movement that they give, the secondary movement that they give, and then the tertiary movement that they give as well. So let's look firstly at the medial rectus. Again, the medial rectus, this is our right eye here, so the medial rectus sits here medially. And the main movement or the primary movement that the medial rectus will give us is adduction. We don't have any secondary or tertiary movement of the medial rectus. And again, one of the reasons for this is because of its insertion. It is not inserted in the eye at an angle such as the superior rectus or the inferior rectus that are inserted obliquely. The medial rectus isn't inserted obliquely or at an angle. Now we have the lateral rectus, which is on this side, and this gives us abduction movement, which is away from the midline. No secondary or tertiary movement here as well because it is not inserted obliquely. However, as we look at the inferior rectus now below here, when this muscle contracts, it helps the eye to depress or go downwards for depression. However, we have a secondary movement, and again, the secondary movement and the tertiary movement is really because of those oblique insertions into the eyeball. Remember, the inferior rectus is inserted laterally oblique on the eye there. So the secondary movement we get is extorsion. So when that muscle contracts there, the eye is going to rotate outwardly. The tertiary movement as well, it helps when the eye needs to adduct. The eye would the inferior rectus will help the eye to move inwards as well. Superior rectus inserted medially oblique at the top here. Our main movement is elevation of the eyes, and then secondary would be that intorsion or that inward movement of the eyes when it contracts. And lastly, it will help the eye to adduct as well. So both these rectus muscles will help the eye to adduct. The inferior oblique, however, this is inserted in the lower temporal quadrant here. Our main movement is extorsion of the eye. So it will rotate the eye outwards. That's its main movement. It will also help the eye in raising or elevating. So when the eye needs to look up, it will have a role to play there as well. And our last movement for it is the abduction or the outward movement of the eye. Lastly, we have our superior oblique muscle, which is at the top here, superior posterior temporal quadrant. Its main movement will be intorsion of the eye, rotating inwardly towards the midline of the body. And then also it will help in depression of the eye or looking downwards. And the tertiary movement of this eye is abduction. Abduction of the eye. So here we can see the side view again. So the lateral rectus here, this will pull the eyes outward, abduction, and superior rectus will pull the eyes upward. Its main movement there. Main movement of our superior oblique is our intorsion, inferior rectus depression, inferior oblique extorsion. And then on the other side, we have the main movement of our medial rectus being adduction. One of the things we have learned, however, in school as well is sign rad. And what sign rad is, it helps us to remember what some of the muscles do. So sign actually means superior's intort. So when we look at our superior muscles, superior rectus, superior oblique, they help the eye to intort. So intorsion and intorsion here is helped by the superior muscles or the superior rectus, superior oblique. Rad, on the other hand, is rectus muscles adduct. So with exception of the lateral rectus, which we know is to abduct, all the other rectus muscles will help the eye to adduct. So medial rectus will help adduction, inferior rectus will help adduction, and superior rectus will also aid in adduction. So guys, I hope this video was helpful for you. Don't forget to share the information as well, and look forward to the Instagram and Facebook pages for the content there also. So guys, you keep safe. I'm out. Peace.